Welcome to my channel once again. Today we are going to take you through the nursing care plan. So over here we have the first page of the nursing care plan, and then this page amounts to a total marks of 6. It's very important, right? This is the basic or background of the whole work. Mostly what you do here reflects in the second part, right? So let's go through this step by step, and then we continue with what else we need to add. So one thing you need to know is that you don't joke with your index number and your signature. That is the only thing you don't have to actually stress with, though it carries no mark, but it is very important. So make sure you just key in your index number and your signature. The next thing is the personal details or personal data, which is 1 mark, right? And then we have the patient problem, which is supposed to be 4, carrying 2 marks. That means each problem is half mark. Then we go to the allergies, which is also half mark. And then the patient strength, also 2 mark. And then each strength should match to the problem, should be in order, and then order of importance as well, right? Then the routine activities is half mark. Very bulky, but this shouldn't be something difficult you can complete. All right all right so let's look at this example to get us oriented on what to do. Let's begin. The key things: your index number and your signature shouldn't be anything difficult. You should have them offered and do justice to them. And now back to the point where you get mark. The patient name is something that you can even easily ask the patient. Before you start work, you are given some few minutes with the patient. So with that few minutes and moments, you should be able to harness all this information from the patient folder. And if it's not a folder, the electronic system is also available. You know the patient, and then the necessary details you need to pick up from the patient. So the name is very easy. Technically, no one should tell you the word you are going to write your exam, because you know the word. So whether male, female, male surgical, male medical, specify. And then the bed number will also be in the system. The religion of the patient and then the occupation of the patient will also be in the system. When you come to the physician or surgeon, it's also in the system, all right. But in case you don't know the doctor, or maybe a patient may actually be under multiple doctors, you can quickly write the medical officer on duty, because that is the right thing to do at that point in time. You can't get the specific name of a doctor at that point in time. There should be a medical officer on duty, right? The diagnosis is also in the system as well. Then operation. When there is no operation done, write none performed. And when it's done, you can specify the operation there, whether appendectomy, let it be written, or whether it's performed or not performed. Specify the type being done. So your key action here is that if it's not done, not done, or none is performed. If it's done, performed, and specify the operation done. Date of admission and date of discharge is also in the system. Place it there. The date of discharge, if the patient is not discharged, it's not yet discharged. That makes it very simple. Now let's jump to the quickest part: allergies. Patient has no allergies, but patient has no known allergies. The patient has allergies, just write the allergy over. The patient is allergic to peanuts. Good. Now let's look at the patient problem, which will secure you 2 marks, right? So you list patient problem on priorities, right? Good. So we have our first problem: the patient has high body temperature, and you make sure that you specify the value of the temperature, 38 degrees Celsius. Good. Second, patient complain of lower abdominal pain. So with the pain, specify the location. So it's what lower abdominal pain. With upper, you specify that chest pain. You can't just say patient complain of pain. Which pain? Where is the pain? Good. Patient is anxious. Good. Then we have patient has inadequate knowledge about condition or of condition. So specify the condition over there. If it's malaria, malaria is gastritis, gastritis. Very simple. And note the problems are supposed to be prioritized, right? So now let's look at the patient strengths. It should correspond to the problems. Already you are done with the patient personal data, secured you your 1 mark, and now you are done with the allergy, securing your half mark. And you are now done with your patient problem, securing your 2 mark. Right. So now you go to the patient strength should correspond to the patient problem. So high body temperature, your patient can tolerate tepid sponging. With this, a lot of schools with their kind of choice of words, but normally we have a standard one that runs through. And here we are using patient can tolerate tepid sponging. Then we have the abdominal pain, where patient can tell the intensity and the location of the pain. Then patient is anxious, go to what patient can tell his fears or concerns. Good. Then inadequate knowledge, we now go patient is willing to learn about condition. That's the strength. Into brackets, which condition will be indicated in the space over there. Let's look at the routine care. Having half mark, not that much of value, but it has value. This is something that you can quickly run through. Very simple. So the asking of temperature, pulse, respiration, which we do commonly 4 hourly. You are done. Then you have BP, which is normally done routinely 4 hourly, but specifically when the patient is monitored for elevated blood pressure, sometimes it's placed on 1 hourly chart. So you specify it's 1 hourly, put it over there as well. Some patients are also monitored for temperature and pulse as well at a particular hour, 1 hourly, 2 hourly. So if it's a special client, you should know that it shouldn't be 4 hourly. There is a specific hours that they use. Very fast you do that. Now when it comes to diet, you should know the diet that the patient takes. Normally, it's a regular or normal diet, fine. You write it, you are done. Or the patient is a hypertensive patient, you go forward the dash diet. And then patient is an ulcer patient or having a GIT problem that's not good for spicy foods, they go for the bland diet. You get it. And then we have liberal diet as well. So yours is to know the patient you are dealing with and then the diet that patient is actually on at that point in time. Good. So we have the fluids. So if it's liberal fluids are just bolus amount of oral or IV fluids being given, right? Or restrictive fluids, meaning little fluid is given, or little or to no fluid is given because the patient is having condition that the patient doesn't require a lot of fluids, especially having edema or heart failure. Then we just oral fluid, the patient is not on any IV medication, you just tolerate oral fluids, just put oral, you are done. When it comes to the intake and output, patient is not on catheter or not monitored, just put not monitored. If the patient is on catheter and then is on strict fluid monitoring, right, monitored, recorded and balanced within 24 hours. So technically we always balance the intake and output within 24 hours. Good. And now oral hygiene, twice daily. Number of times the person bath could be what? Twice daily. Then urine testing, when it's requested, that's why requested and then put what is being tested. But if it's not requested, just write not requested. Body weight is also in the system, can put it there as well. Then we have activity. Activity, the patient is ambulant and the patient is active, can walk freely. Good. If the patient is bedridden, put bedridden. And if the patient is passive, put passive.